So, welcome. My name's Tom Yates. I'm a professor of physical activity, sedentary behavior and health based at the University of Leicester in the United Kingdom.
And I'm Francesco Zaccardi. I'm a clinical epidemiologist at the same department, the same university. Welcome.
This is a discussion of our upcoming paper in the Mayo Clinic Proceedings titled The Comparative Relevance of Physical Fitness and Adiposity on Life Expectancy, a UK Biobank observational study. So this study uses an amazing resource that we have in the United Kingdom now called UK Biobank, which recruited 500,000 individuals into an observational cohort with linked to mortality records. And so we were wanting to use this data to really extend what we know around the relationship between BMI and fitness. BMI has been the classical risk marker for lifestyle for a long time now. But people don't always consider how this relates to other markers of health, such as fitness. In fact, it was over 30 years ago now that it was discovered that individuals who had a high BMI but also had high levels of fitness didn't seem to have the increased risk of mortality that we would generally associate with a high BMI, highlighting or hinting that actually fitness may be protective in individuals who were obese. So we wanted to extend these observations in two important ways. Firstly, rather than asking people to do a VO2 max test or get an objective measure of fitness, we wanted to see whether a very simple but very powerful measure of physical function, walking pace, also showed these types of associations. And we also wanted to give our results in a more interpretable way, rather than just reporting hazard ratios, which can be quite complicated for a non-academic community to understand. We wanted to present our results in terms of actual life expectancy. How did predicted life expectancy vary across levels of these two exposures? We also wanted to look at hand grip strength, which is different to walking pace, and it's a measure of primarily strength. Hand grip strength is related to whole body musculature in effect. So I'm going to hand over to my colleague Francesco now to tell us a bit more about the methods that we used to underpin this paper.
Yes, so as you told Tom, the great advantage of UK Biobank is not only that it's very large in England, but it's also quite recent cohort. So started in 2006, and this is quite important because now we know that the relationship in between the BMI and mortality is no longer like 35, 40 years ago. This is very, very recent cohort. And then within this cohort, and using walking pace as a simple measure of fitness, we have, instead of calculating the relative risk in terms of hazard ratio, we have estimated the life expectancy, because the hazard ratio is a very difficult to interpret measure. It's just a relative measure, and you can have the same relative difference with completely different absolute differences. For example, if you just say that you have an increased risk of 2 times, this would mean very different absolute risk effects. You can multiply 5 by 2 and get 10, but you can also multiply 20 by 2 and get 40. The differences are completely different, the absolute difference. So in this perspective, we decided to focus in terms of how many years you live longer or shorter by different levels of BMI and different levels of walking pace. And this is essentially an estimate of the probability of having a certain event over time. And then, technically speaking, we just created the survival probabilities for different ages. And this gives very clear message, because you can compare what is the effect of changing the BMI or changing the walking pace in terms of how many years you live longer or shorter. For example, 3 years longer, 4 years longer, and so on. So this approach, moving from the relative measure to the absolute measure, is, we believe, a key point, an essential point, and one of the major strands of the manuscript, and gives us and the reader, of course, a better interpretation of the interaction in between the BMI and walking pace on life expectancy. As indeed, Tom, as we discovered, as we have demonstrated, the impact of BMI can be very different when you change your walking pace status, because if you have a very good walking pace, if your walking pace is fast, the impact of the BMI on the survival is lower compared if your BMI is smaller. So essentially, after certain values of BMI, the life expectancy is quite long, independent of what is the level of BMI if you are a faster walker. So this can be easily interpreted in terms of how many years you live longer.
I'd just like to highlight some key results because I think they're absolutely fascinating. So to start with, we had about 3.3 million person years to play with this data, and over 5,000 deaths in women and over 7,000 deaths in men. So we had plenty of power to look at life expectancy within these different categories. When we looked at the classical hazard ratio approach, we found that actually, maybe contrary to what people would think, the highest risk group for BMI was in the underweight individuals. So people with a BMI of under 20 had a higher risk of mortality than those who are actually very much overweight, 40 plus. Same for women and men. And people with a fast walking pace compared to people with a slow walking pace had over half or 50% reduction in the risk of mortality. So starting with that sort of classical viewpoint, then looking at life expectancy, we found that actually in that underweight high risk group, there was a huge difference in life expectancy between slow and fast walkers, equating to over 20 years in men and about 15 years in women. That difference became less as people's BMIs got higher, up to about 3 years in women and 8 years in men. So what this study really confirms is that when you're talking about BMI as a risk factor, it is very definitely modified or modulated by fitness variables, particularly walking pace. And if you are a fast walker, you're going to have a very high life expectancy regardless of your BMI. The difference at low BMI is probably due to factors like frailty, where people with low BMI and slow walking pace are going to be at particular risk of all-cause mortality and poor health, whereas thin individuals who are fit are obviously going to be much more healthy.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.